Good evening, everyone. It's Wynn Brown here with Heywood Healthcare's COVID-19 update for Monday, the 30th of November. Hard to believe that December is upon us and knocking at our door. I hope you're all doing well and had a wonderful family holiday for Thanksgiving. Probably much like us, much smaller than our usual gatherings, but we're all doing our best to make sure that we're helping manage that pandemic on a personal front. And I appreciate everybody for their personal sacrifices that they're making to really help keep the pandemic under control so that your community health system can make sure that we can take really good care of you throughout the year, especially during this holiday season as we head into the winter months. I know you're all curious about our numbers. So at Heywood Healthcare, it remains, our cumulative rates remain exactly the same as they have for a couple of months now. Our cumulative rate is 2.4% versus the state at 2.5. We have inched up a little bit on our 7-day average rate, which is 2.88 versus the state at 3.0. So we're just a tiny bit below the state, which is good news. But the bad news is that I see so many positives coming through, really with the largest numbers of people in their age 30 to 40, and then under that as well. So a much younger population in our region being tested positive for COVID-19. And of course, many of them have their symptoms aren't as acute as in much of our older population, but remember, we need to be very careful around our older population as well to make sure that we don't spread it to them. So please, everybody, be super vigilant. At Heywood, despite the larger numbers we have for testing in our community, we remain at 2 inpatients, one on Watkins, one and another patient under investigation. In Worcester County, total positives, they were up to 23,608, and Franklin County moved over the 600 mark to 605. I just want to let everybody know who are coming to our facilities, especially the 2 hospitals, that we want to remind you of our entrance protocol. Some people are arriving with bandanas and gaiters in lieu of a mask, and we don't allow that in our facilities. So you will be given, if you're not wearing a surgical mask upon entry, we will be giving you one. We ask you to wear that or a really well-made handmade mask in our facilities for your care. But bandanas and gaiters are not permitted at this point in time and haven't been historically, but we just need to remind people because we see an uptick in folks arriving with that. So please be very thoughtful and kind and considerate to our entrance screeners and follow their directions while you're getting care inside our facilities, and we're happy to have you there. Flu vaccine, we still have a number of staff who have not gotten their flu vaccine, and as you know, we call it the flu buggy, will be set up in the administrative area and Heywood Medical Group on the 2nd floor from 9 to 4 tomorrow. And all staff need to get tested, I'm sorry, not tested, I'm a little off today, need to get their flu vaccine, I think it's by December 5th or 6th, or if you haven't signed an official declination for allowed purposes or gotten your flu vaccine, you cannot report to work. So you cannot be scheduled and cannot report to work. So please, everybody, get that done as we remain vigilant to try to take really good care of ourselves, our patients, and our community as we continue our journey to be one of the best community-owned health systems in America. Have a great evening. I'll see you on Wednesday.